Happy New Year to all of you viewers of Bethany TV for Health. I'm very sure you are set for a new year with different goals. Now that we have our kids in the holiday, now it is very, very important for them to have quality and healthy as well as plenty sleep. As if it is not having issues disrupted or unhealthy sleep, they are likely to have healthy problems as well as learning disabilities and so many other difficulties, including not gaining weight very well. Now, about 50% of children have sleep disorders. That is sometimes abnormal movements during sleep, failure to catch sleep, or excessive sleep during day. And the question is, what causes this and what can you do as a parent about this? Are there things you can do to improve the quality of sleep for your child? This week on the Pediatric Voice, and that is tonight, we are going to discuss the sleep disorders in children. What are those things? What do we call abnormal sleep? And is it really important to have quality sleep in a child? And today, we have Mr. Tumsime John, who's a psychiatric nurse at Entebbe Regional Referral Hospital, as well as the CEO to Lifeline Health Services. I am your host, Dr. Helen Namsoke. Welcome to the Pediatric Voice. Welcome, Mr. Tumsime, to the Pediatric Voice.
Thank you. Yes. I'm so delighted to be here once again. Happy New Year to our viewers. It's a new year, new feeling, and hopefully we shall have a good one.
Thank you for honoring our invites. Okay. Now, you can watch us live on Bethany TV Uganda, that is on Facebook, X Spaces, and YouTube, as well as tune in on channel 170, that is on free to air, and 841 on GoTV to follow through the discussion on sleep disorders in children. Mr. Tumsime, is sleep that important? And if so, what is sleep to begin with?
Sleep is very important to our human body because sleep is getting our brains at rest, internalizing what has been going on, and through this it prepares our body or our brains to have a decent rest in the night, because we are programmed physiologically or biologically from evening hours. Our bodies tend to be worked up and they need a rest. So during this period, you're going to sleep over and your brain is not going to be function as it was, but the brain does not stop functioning when you're sleeping. During this period, it's when the cells are rejuvenating, re-establishing afresh once again, because during the day you've been up and down doing a lot of things.
So in others, the brain cells eventually get tired.
Get tired. But when they get tired, they get refreshed by sleeping.
During the rest. Yes. So must sleep happen in the night?
Yes, because that as far as the circadian rhythm is, it's an automatic clock of the brain that at a particular time you're going to be knocked off and you need to sleep. And sleep, to have sleep, you're not going to have sleep just like that. Yeah, sleep has a different stages,
Before we go to the stages of sleep, what is sleep?
Sleep is a state of body and mind that prepares you to relax, rest your brain.
Okay.
Simple like that.
Does it have to happen in bed?
Yes, at the same time, no. Because of a different, now I will talk in terms of an adult, because of a different work schedule, we may be working at night and then our body re-establish itself in a different format. Like now I've been working at night maybe from 9 up to 6. Now after that I've been working, I'm exhausted, I need to go and have a nap. But as well as during the day when we are working, or when you are active, still we also have naps, like when you're burnt out, you're exhausted, you can have a nap. And during that nap, you're going to have sleep. A nap can be...
So it can happen in the chair?
Yes.
In
so
the
you
car?
can be working and then you get off and then...
At my desk?
And sleep. It's normal. But also having a nap during the day, it also means there's been a problem with you at night. That means you never had quality sleep.
Okay. Before defining sleep, you said it's better off when sleep happens at night.
Yes.
But there are, leave alone the children, there are people whose kind of nature work requires them to work at night. Leave alone health workers who have night and day shifts, but they also do the kind of staffs that where by most of their work happens at night, like the security officers. I think
even people who are working media
people, personnel, yes.
And even organizations that have to keep on working
24
hours. There are people in the background operating the system, so they have to be alert. So now that kind of person will not sleep at night. So the cycle will be different.
So they change their rhythm.
They change their rhythm, basically.
Okay. Yes. What had before you wanted to tell us about the stages of sleep?
Yes. Now to sleep, we have two main stages of sleep. We have the non-rapid eye movement stage that has also basically 3 or 4 stages, whereby in stage 1, your body is turning away from awake to sleep. So
that is what happens if immediately you put your head down?
Yes, in the first 90 minutes, 60, 90 minutes. So your brain is preparing itself to get into sleep. Then from there we have the stage 2. Stage 2 is usually more deeper than stage 1. And in this, your body is at relax. You're getting into comfort of preparing your brain to cool down and get into working. So even our brain waves will be slow and there will be some peace of mind. And then from stage 2, we are preparing ourselves to stage 3, which is deeper in stage 1 and in non-rapid eye movement. Now, in this stage, you're deep, but does not prepare you for stage 2. So when you go into this deep stage 3 of non-rapid eye movement, you must go back to stage 2, which ushers you into the rapid eye movement stage.
Okay.
You're getting me?
Yes.
Now, in the first stage, when you bring in the disorders, that's when you will have the night terrors, the obstructive sleep apnea.
Because the brain is still sensitive to your body. So in others, is that the stage whereby if someone slams a door, you can easily, or shouts, you can easily wake up?
Yes, we shall come to that. Then after going back to stage 2, it is ushering you to stage 2, which is rapid eye movement stage. And in here, you're going to get into real sleep, where your brain is going to be relaxed, everything is going to be at ease. But at this stage still, we are going to see melatonin being produced high to prepare other metabolism to take place. That is, it's a stage where now recording, concentrating, recalling what has been going in, it's more of a library for that.
Is that when we dream?
Yes, that's when we're going to dream. That's when we're going to have these nightmares because you're completely off. And in this stage still, now in the first stage, the heart rate, the breathing is slowing. But in stage 2, the breathing, the heart rate is kind of high. You're getting, because that means now you're resting, other things are taking place, so your body is getting energized to rest and relax and
in preparation,
for you for that day.
Okay.
And it is already, we always have these cycles in the night. It's not that now that our stage 1 has finished, it's not going to come back. So there are moments whereby you're going to get tired and you again go back to stage 1.
Okay.
So in stage 1, maybe now you've been aroused by something outside, and then you're waking up, and then again maybe you're going for a short call, or maybe you left a phone on and you're hearing it, and then again you prepare afresh. So it's just a cycle. You're getting it.
So how long should someone sleep? Let's say a child over 0 to 5 years.
Between 0 to 3 months, a child is supposed to be sleeping between 14 to...
About 16 hours.
14 to 17 hours. They're just sleeping. That's why you see when the newborns are just sleeping, they're just enjoying their
They just
world.
sleep and feed.
You try to play around and but for them, they're in their own world. Then between 3 months to 6 or to 9 years or to 1 year, they are taking an average of 14 to 6 to 15, around there. Then from 1 year plus, they are going to be from 10 to 12. Then from the preschool, from 1 year to 3 years, around 10 to 13 still. But from preschool, it's 10 to 12 or 13 years, depending on how the child has been active. Then from third year, third birthday, they're having an average of 8 to 10. Then an adult, it's between 7 to 9 hours of sleep. So for an adult, it's between 7 to 9 hours. For the younger ones, their whole life is about sleep and rest. Because this prepares their mind, their brain, to coexist in life and prepares them to be healthy.
Okay, a very interesting discussion here tonight on the Pediatric Voice. We are discussing sleep disorders in children, and I'm very sure some of you are already culprits of this, me inclusive. I've actually just realized I don't even know when I last had more than 6 hours of sleep. I don't know how many years ago. I mean, it's rare that I even catch 6 hours of sleep. So I can imagine adults having to have about 8 to 9 hours of sleep. For some of us, seems like...
Because of life demands, we end up now programming ourselves. But the moment you program yourself, yes, an average of 6 hours is enough.
Within 24 hours.
Within 24
Must
hours.
These hours of sleep be a constant, or they can be taken in bits?
Now, it's not about taking them in bits. That's why some days, when you're burnt out, when you're exhausted, you don't want to do any other work, you'll go back home early. Because the body is demanding
for rest. You're getting, so there's that compensation mechanism that will catch up with you. You can pretend around that I'm busy, but there are days that you're going to come in there and it is you to take on that mantle that I must rest. But for the normal setting, between 6 to 9 hours, you rest. Let's leave the adults alone and concentrate on our children.
On the children.
Because,
and not children, this is the age of development. The age of development. So in this age of developing, they must have quality sleep.
Okay. So you're talking about quality sleep. Is it only about the timing of the sleep? It is, what is more to timing of sleep?
Quality sleep has a lot of issues. It's not about the timing. We are going to prepare our sleeping area. Even if you have a one-bedroom house, you have
so
to
the sleeping area is equally important.
Is important. Why is it important? If it's time for sleep, the lights should be off or the lights should be dim. That's number one. You're getting, because you're preparing your brain to take off. However, for the blind people, it becomes hard to understand the kind of environment
it is day or night.
So now it goes back to the physiology of the brain, the circadian rhythm, like, now by this time now, I'm off, I'm going to sleep. Because the body is tired, it's exhausted, and they are going to sleep. So sleep environment is very important. Now for children also, after sleep environment, we must set time for them to rest, usually 8.
So they should have a constant time.
A constant time.
There is nothing like, today daddy came back at 11, I have to wait for him.
Yes.
Tomorrow it is at 4 a.m.
Yes, it's supposed to be timely. That's why you see, even those who are not going to school, we prepare them during daytime to relax so that at night they can have enough time to sleep.
Okay.
You're getting it? Because if you don't prepare them to sleep midway the day, when they are there, it's going to be totally a different story. So from environment to timing, we set up time for the kids between 8 and 9.
So timing involves the number of hours they are going to sleep.
Yes.
And
the hours
when should sleep be?
Yes.
Or in other words, start.
Yes.
Okay.
Then we finish timing. We're going to drinks of caffeine, the coffees and so on, should be 6 hours before programmed set time. Maybe
in other words,
8, 9.
The tummy. The abdomen is very important.
Yes. Now also, food should not be much light meals for the young ones. Even
because
as
a full
adults,
abdomen,
a full abdomen becomes discomfort.
It's going to work up the brain.
Exactly. Then from there, we're also preparing our young ones, the kids. We don't want to entertain them with attention issues, maybe like gadgets like TV, radio, tablets. In this modern era, there are tablets. So we tend to take them away from them. That is vis-a-vis with the environment. Now also that, we also prepare our children. I have a friend who is, I think in France, who in a WhatsApp group, she said, she was communicating that I have to read for my babies, my kids, storybooks. And to me, I've never done this. But when you're going to research, when you prepare your child with storybooks or with stories that are calm, they prepare the child to fall asleep. And from there, they're going to have quality sleep.
Okay.
Then you're also going to have, I've talked about that, we're also going to talk about unpleasant activities like noise or sounds and name it. For people who are in loud places, it becomes a discomfort for them. So we prepare our kids' sleeping environment to be pleasant for them to rest. So with that, you're going to have quality sleep. But again, we're also going to avoid other stimulants like medication, because the child, you are going to give them medicine, because you're like, do this and that. So
sleep should happen naturally.
Unless you're diagnosed that you need to have medication for this.
Because like if a child has pain and all that.
There are those stubborn parents that are like, let me get a tablet and I give, and then...
I've actually ever seen a child who was being given Pilton by a helper at home, by a house manager, because the child takes long to catch sleep and she has plenty to do.
But again, with the other psychiatric condition with the child, especially in seizures, stroke epilepsy, then with attention deficit, hyperactivity, these children must be given these drugs so that they help stimulate the brain, relax, because it's part of the medication so that they are not active during night. You're getting so conditions that are held by the children must be managed with the medication. That's different from a normal child, whereby for you want to watch your Telemundo and your child is crying to be awake, and let me get a diazepam. I want to go for a Passover at 31st, let me give a pill. So you're disorganizing child's brain.
I'm picking something very interesting. You see, sometimes parents tend to work longer hours, and because with a traffic jam, they leave home so early, and then the kids, they come back quite late. Then you find that the kids want to wait for the parents. So it's actually affecting the quality of sleep these children are having.
It is, you know, and even with our education status currently, you see children waking up by 6. By 5, you're preparing because you're fighting jam. So still they're not going to have quality sleep.
Very interesting discussion from Mr. Tumsime here about quality of sleep one should have. It's very clear the environment and the timing as well as the duration of sleep is very, very important for your child to grow healthy and for their brain to rejuvenate very well. You are watching The Pediatric Voice. Do not touch that remote. Let's come back after the break.
Bethany TV for health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and Afro mobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for health. Bethany TV for health.
Welcome back from the break and thank you for watching Bethany TV for Health. That is on channel 841 on GoTV, 170 on free-to-air, as well as Bethany TV Uganda. That is on X Spaces, Facebook and YouTube. And you are watching The Pediatric Voice. And today we are discussing sleep disorders in children. I'm your host, Dr. Helen Amsoke. And we are hosting Mr. Tumsime John, who's a psychiatric nurse at Entebbe Regional Referral Hospital. And we've had an interesting discussion about quality of sleep, where we discussed that it is very important to have an appropriate environment for you to have good sleep, as well as the duration of sleep and the timing of your sleep, equally important. And I don't know, some of us already culprits of poor quality sleep. So, Mr. Tumsime, what are those precautions one ought to do to have good sleep?
We've already highlighted the precautions, but maybe, like I said, timings, environment, lights down, light meals, avoiding caffeines, those who avoid medication, those with the condition that need them to be on medication, give them. Also storytelling before they sleep.
Singing, singing to them help?
Yes, the lullaby. The most important, the precaution, what happens with our current, our mothers and parents when they're having children, is making the child sleep into your arms or on your lap. It's not very good. Just make sure that when a child is tired, let them go to bed.
Some children are quite clingy.
Yes, That's why I said in the beginning, timing, at 8, you must be there.
So the baby's brain is tuned that every 8 p.m. I am
have to be in
resting
bed.
somewhere.
So what brings a child to be stubborn? Because you're not being serious with instructions. Because you're still enjoying the TV, you want the child to watch with you, to entertain with you. So at the end of the day, they are going to be affected. You're getting me?
Okay, that is very important.
Yes.
So having seen what good sleep
Yes. So we are going to the abnormal.
What are
the
sleep
abnormal?
disorders?
Abnormal. Yeah, there are majorly around 4, 5, 6 major conditions in children. And I will start with sleep apnea or obstructive sleep apnea. Alright, this more is characterized with failing to breathe like 10 seconds and then you breathe. And then some of the characteristics you're going to find children snoring.
Dear viewers, maybe to define apnea for you, it is a state whereby you stop breathing for a few seconds of your life. It's called apnea.
Yes.
As long as it lasts up to
10 seconds.
10 seconds and more, it's called apnea.
Yeah. So
Yes.
you're going to notice this in children and you're going to see that. And sometimes even when you're sleeping with a child, you're going to feel it. You're getting it. Then other characteristics, like I said, because of the sleep apnea, there's going to be snoring also. Now with the snoring, it's also going to obstruct the breathing pipe. And this will affect the child's sleeping pattern.
So what really brings this?
What brings all this, mainly it's distress, anxiety. Most of these challenges are brought by distress, anxiety, and underlying medical conditions. You're getting it.
Like something partially closing the breathing pipe.
Yes, because some of these issues were just inherited from parents or their effect of other situations that are coming on board. So you're going to notice that. Then we also have the restless leg syndrome. In the restless leg syndrome, here the muscle tone, the relaxation tone of the limbs, especially the leg, are going to be engorged. They're going to be briefs. They're going to be hardening of them, and it is exhibited predominantly in the night. And you find this child, you find it is sometimes painful when the child is undergoing this challenge.
Is that what we call a muscle pull? That someone got a muscle pull while sleeping?
Yes, perhaps the muscle pull, but it's more of on muscles and on the lower limbs, especially the legs. So it's going to be predominant in the night, and it's going to be on and off. And this one also is also due to, now that one comes in when there was an issue giving birth to the child in the beginning, during birth. Usually when there is lack of oxygen supply.
Also their brain gets affected. So in other words, there are interruptions
Exactly.
the nerve makeup of the brain and the release of chemicals from the brain.
Yes, it's affected.
Okay.
So that is also going to be observed. The third one, which is common, and the fourth one, we have what we call nightmares. Now, nightmares are common you remember when we talked of the stages,
yes,
they are common in the stage 2, sleep.
That is the deep sleep.
The deep sleep. With the nightmares, you're going to have unpleasant dreams about animals chasing you, ghosts, images that are threatening, and the child is going to be having these dreams. And mark, in nightmares, the child recalls the events in the night. You're getting it? So that is more predominant there, the child recalling. Now we have what we call night terrors. Now with the night terrors, it's common in stage 1.
The light sleep.
The light sleep. Here the terror is the child gets frightened. He has fear. You tell the child you can't sleep, you're like, the child is waking up screaming, is sitting with confusion.
Or he's walking around.
Yes, sometimes walking around. But that also takes you to another condition, sleepwalking, which is also different, independent on its own.
From the night terror.
From the night terror. There's sleepwalking, which is characterized by child waking up, even as adults, you're moving in the night, but you're just confused, you don't know what's going on, and you're just there. So it's common in children. So you find the child waking up, doesn't know what's going on, and is going the other side, maybe he's going to the bathroom, going to the toilet, or moving around the bedroom. You're getting it. So those are what? Night
terrors.
No, sleepwalking.
First, how would one differentiate between night terrors and nightmares?
I said in nightmares, these are unpleasant dreams. In night terrors, excessive or unpleasant fear. The key word is fear. Being alert, your child is screaming. It's not dreaming, but the child is screaming. And this one is also due to what has been going on with the child's life during. So
it is actually more related to the real-time
experience, environment of the child. You're getting it. Especially kids who are exposed to TV and they're watching funny movies or videos, something of that kind, or child who are exposed to torture in the home, domestic violence, and so on. So that is more
of a night terror.
A night terror. Someone
Do
wakes
they
up
remember
fear.
what happened?
No, in night terrors they don't recall.
So actually, you can ask a child, why were you screaming?
It's not there,
and they can't explain.
Exactly. Even in adult, it happens. Okay. You experience this and like, Bana, you were shouting, you were doing the like.
And they even deny, was I even shouting?
It's not that. So those are major characteristics, or those are the major sleep disorders. There are others. I was talking about sleep arousal or sleep confusion.
Okay.
Sleep confusion. Now that is different from a terror where you're screaming, you're fearing. It's different from a nightmare, dreaming. In confusion, they're in bed, sometimes their eyes are open. It's not sleepwalking, but you're just confused. You don't know what's going. You can't tell what's going on with this person in this situation. So there are those kind of challenges you're going to meet in children when they're having this problem.
How do they present?
There is behavior challenges that are going to manifest. Like I said, confusion, being eyes open. You're telling them they are not awake, their eyes open. You're trying to talk to them to think that they are sleeping and they cannot even respond to you, but they're in bed. You're getting it. So that's the characteristic, basically.
Okay.
Yes, please.
Oh, what about bedwetting?
Bedwetting goes back. It's a characteristic of obstructive sleep apnea. It's a characteristic because it's highlighted in there. Here, the sphinctermatous at the bladder, urinary bladder, are not controlled, so the child just passes out
without noticing that the bladder is actually full. Okay, very interesting discussion. There are children who grind their teeth.
Yes.
And actually it is a common symptom parents come with.
Yes.
What is it related to? Is it
it's not a disorder, but it's an abnormality. It's an abnormality, grinding teeth or biting teeth. You're getting it. Sometimes they're doing it in a subconscious manner. They don't know what's going on. You're getting it. So it's a characteristic, it's not a disorder.
Okay, Mr. Tumusime, on a general perspective, having seen the different disorders, how would, as a parent out there, how would I know that the kind of sleep my child is having is abnormal?
Now, here, the mother or the father, because you may talk over the mother when there's a silent.
Sometimes it is the
father,
or
whatever,
the
grandfather or the caretaker.
Yes.
It's usually the caretaker. So when the child has sleep problem, these are the main characteristics. Fear during daytime, not sleeping at night. There's a difference of sleeping and not sleeping at night. So now you notice, why is my child always awake? Now, there's being tired during daytime. Now that is an indicator at night this child is not resting. Okay. And usually you'll come to learn about this. Maybe they're sleeping with gadgets, they are being active during the evening hours between 8 and 11, so you don't expect this child to rest. There's also poor concentration during class or during daytime. The concentration is hindered because the brain did not have enough rest.
So in other words, their learning
is affected.
Okay.
Then we're going to also to see manifestation of psychiatric conditions like anxiety. In anxiety, we are going to see issues like palpitations, increased palpitation, heart rate, breathing, and name it. Then we're also going to see issues with metabolism condition manifesting in children, and mainly type 2 diabetes.
So you find that the child is gaining weight?
Gaining weight because of the underlying condition that is manifesting. We are going also to see a children having poor mood, mood swings during the time. Like most of these characteristics, when they present, they drag us into mental conditions, mainly when these children are presenting with these challenges. Now we're also going to look at even these children who have this psychotic condition, the epilepsy, the ADHD, and so on. They are dull during daytime. They are not active, and they're just sleepy. They're just there. You're getting that. Then also you're going to see a characteristic of overeating or not eating during daytime. It's going to be one of the presentation of this child. So it's 1 or 4 of these symptoms that you're going to notice.
Okay, that is very, very interesting. Now, are these disorders, do they require treatment? And are they there for a lifetime once you're diagnosed with one, or they keep changing?
Now, with the management of sleep, it is in 3 phases. For the children below 3 years, we are going to reassure them. We are going to talk to them. It's going to be part of the growth development in them. So it is expected. After 5 years, they start winning off those challenges. So you just have to prepare them, or you prepare yourself that this is expected in them.
So now the sleep disorders tend to go away as the child grows by their own. Okay.
Now, 2, when the sleep disorder is there, it's an indication of a psychiatric manifestation. So we are going now to explore more on understanding the child's mental state. And in child mental state, we are going now to explore, is there ADHD? Is there autism? Could there be epilepsy, seizures, and so on? Could there be a psychosis? Because when there is a nightmare coming up, when there is a terror coming up,
maybe they have a hallucination somewhere.
Exactly. Then now, because of that, a manifestation of hallucination is going to be there. You're getting
maybe
it?
hallucinations is when you're seeing things or hearing things that actually are non-existent.
Yes.
When everyone else is not hearing that voice you're hearing or seeing what you're seeing.
I try as much as possible to use the plain English so that our viewers, because we have professionals who are listening, and then the layman person who is there. So now we are going to go into assessing the mental state of this child. That's the first intervention. Now, after assessing, we are going to see, does this warrant us to diagnose? Now, if it is we are diagnosing, we're going to go to these disorders we've seen and match them with the condition we have
in that child.
In that child. Because sleep is a manifestation of its own, of a psychiatric problem.
Okay.
Are you getting me?
Yes.
So it's not going to be that it's one island that's the problem you're going to handle. There should be an underlying issue. So because of that underlying issue, now we are going to have medication. You're getting me? So the medication is based on how the child's mental condition is, and we shall diagnose them. Now, also, in our medication, we have 3-4 types of medication we're going to give. If we're just going to try to induce sleep and so on, we're going to use benzodiazepines to help this child get into there. But now if you're going into the psychiatric evaluation of this child and understanding their condition, we're going to have antipsychotics, we're going to have antidepressant being administered basing on the presentation of the child. You're getting.
Are there other measures that can be done other than doing the drugs?
Yes, there are other measures. Like I said, because it's a behavior problem along the way, we are going to bring in the psychologist, and we're going to employ CBT, cognitive behavior therapy, trying to understand this child, that this is the problem, and we need to help you and work out and get better. So the psychologist is going to play a role in this problem. You're getting me?
Is it only done to the child or to the rest
No.
of the family?
No. In mental health, it's
a family therapy.
It's a holistic approach. Because if you're going to only isolate the child, the mother or the father is already traumatized. They must be psychoeducating the caregiver what is expected of them and what is their expectations in giving the treatment.
Okay.
Because in giving the treatment, we have what we call psychosocial support. Apart from counseling, have you understood what we are dealing with? And if you've understood, you must give in your weight. Now, the psychosocial support means the warmth of maybe resources to take the child to hospital, the resources to buy medicine, the resources to prepare the bedroom at ease. You're getting me? Because if we've identified that the bedroom has a lot of lighting, we are going to ask you, please do this. If we have identified that this child has these gadgets, we are going to say, please do this. In the beginning, I was telling you, if it's time to sleep at 8, let the child go to bed. Don't sit with the child to sleep, to watch your TV and you're with them, because you're affecting the quality of sleep. So it's a two-way traffic. You're treating the child, but also helping the caretaker understand what is expected of them.
Does it involve the teachers? Because sometimes they may not understand why the child's performance is deteriorating.
Yes.
Maybe the child is dozing in class.
Yes. Usually, like I said, after the mother complaining or the father complaining, I'm seeing this child blah, blah, blah. He has come to the hospital. We've assessed. Are you getting me? We've identified this condition. Some of these conditions need specialized school environment, because now the specialized school environment has a niche in managing the child. But again, there's the normal schools. Now we have also to prepare the teacher of this student, of these people. You see, if John comes to school, if he wants to sleep, let him sleep, because he has this problem. We've seen in school where people have asthma, and like it's a privilege. I will not go for prep.
You don't sweep.
I will not sweep. It's not that it's a privilege, but we are trying to help this person have a good health environment.
Okay.
So the teacher, the other side, must know, but it should not be an excuse to misbehave in class. Now, those are two issues that may come up.
Okay, having seen the disorders and everything, if once a parent has noticed that their child has some of those signs and symptoms, where can they seek help? The hope is everywhere. I would say everywhere. When I say everywhere, at all national level hospitals, you're going to find a physician who will know the condition. But all hospitals, the big hospitals, and talk of big hospitals, talk of regional referral hospitals, private hospitals, they have specialized pediatrician, psychiatrists, psychologists who will come on board to help the child or the parent when this person is having it. So the moment you have a child who has these challenges, go into these hospitals. I would call it the big hospitals. Because at the hospital, you're going to find all levels of care professionals on board. And you also find specialized professionals on board. You're getting me? So that's what I can say. But also, at lower levels, even professionals are being trained. They can still identify. And now, for sure, I'll not handle this, but I'm referring you to this facility.
To this facility. So it's a chain of command. So don't hesitate, like because you're in Kabera Baido, you can't access, go to Moroto Regional Referral Hospital.
You'll find
a psychiatrist there. If they can't find a psychiatrist, go to the health center you'll find a physician who will be able to intervene, and if he's not able to intervene, he will guide you. Maybe this is a referral, go to this type of facility, will get this problem. However, most of these conditions are managed in the mental health department. And the mental health department comprises of the psychiatrists, the nurses, the psychologists, social workers, counselors. So when the child comes, or when the client brings in the patient there, they will attend to them with all the open hands.
Okay. Yes. Having learned sleep disorders tonight, what is your take-home message to the public?
My take-home message, it's a new year. And our children are home. So if they are home, take the message kindly. Prepare your children, have a quality sleep. And the moment you have that, you're going to prepare their brains, their psychosocial development good. And they're going to be good citizens tomorrow. They're going to be good parents tomorrow. They're going to be good mothers tomorrow. That's what I can say. And if you identify this challenge, please don't die into your own movie. Don't go into myths that is a curse, this is blah, blah, blah. Walk into a hospital, bring your child, we shall manage them.
Thank you very, very much. Yes, we've been having Mr. Tumsime John, who's working with the psychiatric team of Entebbe Regional Referral Hospital, as well as a CEO of Lifeline Health Services, and he has been teaching us about sleep disorders in children. Now, a new year comes with several resolutions. I'm very sure some of you have come up with so many resolutions that are spiritual, financial, work-related, and so many others. Guess what? Sleep resolutions are equally important. And from our discussion, it is very clear that it starts with us, the adults. We affect the quality of sleep we give our children. Sometimes we wake them up too early, or we send them to bed too late. Maybe because we work long hours, and maybe our children are waiting for us to come back from work because they want to have a social interaction with us. So as we are hanging out there, we need to be mindful that we have a child that needs to go to bed maybe by 8 p.m. So daddies, mummies, please try as much as possible to come back home early so that your children you ensure that your children are going to bed on time. Very important to have a serene and clean sleeping environment to your child. In your convenience, try to find as comfortable as possible a sleeping area for your child with minimal distraction, maybe in a place where people don't usually pass by, to make or interrupt a child's sleep. Avoid banging doors, avoid shouting in the house while a child is sleeping. Try to switch off the lights. Yes, we love with a computer utilization environment. Let's try to reduce or minimize gadgets during sleep for our children. The business of putting on cartoons as we are sending children to sleep, I think it's not a good idea. Sometimes it is the reason they are getting night terrors. So in other words, we try to do more soothing for them to sleep, either telling them a nice story or singing to them, you know, that nice melody is likely to give them better sleep than a horrible, scary, or noisy cartoon on their gadgets. That is it we had this week on the Pediatric Voice. I've been your host, Dr. Helen Namsoke. Thank you.